purpose of the system as a whole?
So our purpose, or what I call our raison d'etre for why we exist, is we want to improve the lives of West Virginians. And in order to do so, we believe, and there's really good evidence to suggest that if you build an integrated health system where you have primary care services, community-based specialty services, community hospitals, academic medical center, and the emergence of what we call post-acute care, that you can really build a care continuum that offers high-quality care for patients that we serve, and and would have an opportunity to be an anchor for our academic programs, because we are also committed to training the next generation of health providers with our partners at WVU and other partners in the state who have their health professional students rotate with us. It also affords us the opportunity to bring in new talent, new folks to help with that mission. We are also engaged in discovery, but discovery focused on practical things to be able to really make a difference in patients' lives. So we have, with our university affiliation, the opportunity to look at very fundamental science all the way up through and including clinical research and health services research. So bringing that whole package together, we believe, will help raise the status of the reputation of the health system, but more importantly, to raise the health status of our patients who use our facilities and our services.
It's always impressed me when I read through, as an employee, the mission, and it seems like the common theme is always we're going to improve the health of our state, which seems such a lofty goal, but attainable when you combine your forces. And as you said, there's so many members, so that really is achievable.
Yes. Yeah, it's a noble mission, and it's an important mission, because we need to be mindful of not only what it means to move from an illness focus, that is treating patients with diseases, to shifting the priorities and shifting the vision to maintaining health and vitality and successful living, or as a geriatrics person, I used to say that's successful aging. But in the reality is that doctors are not just the part of that health professional team. It really is interprofessional. And having a system like what we are pulling together now allows us to have the resources of multiple professions to begin to raise the health status, from nutrition to high quality nursing care to oral health has become an important component of our portfolio, mental health and behavioral health services, including addictions medicine. The whole fabric of what we are trying to do is to bring services to patients where they deserve to receive them.
And as we know, people always do better when they are close to home.
Yes.
Especially in this area. Culturally, I think people really like to be, in their town. So you mentioned that there are 8 other facilities, and let's talk a little bit about what other hospitals other than Camden Clark are part of the health system.
So if we move east to west, we have Jefferson Medical Center in Jefferson County on the eastern panhandle, and Berkeley Medical Center, which is in Berkeley County. Then we have Ruby Memorial Hospital, which is the academic medical facility that's associated with the university. We have Potomac Valley Hospital, which is up in Kaiser. And we have an affiliation agreement now with Garrett County Memorial Hospital, which is in Oakland, Maryland. And we have United Hospital Center over in Parkersburg, and then we just brought on St. Joseph's Hospital Buchanan, and of course then we have our anchor here in the west, which is Camden Clark.
So lots of different facilities throughout the state, and the other thing that I am always impressed with is the goal for the standard of care, of course, to be the same. At each access, which I think is important for our viewers and for patients to realize that as they go from these different facilities and institutions, that there's a standard of care that's expected from each one.
Exactly, and I think there's 2 important points about that. One is from the consumer's perspective, from the patient's perspective. It is our intent that whether you receive services at Jefferson or Camden or at St. Joseph Buchanan, that the patient care experience will be high quality and similar and have the same value proposition across the entire system. And from the clinical perspective, we also know from the research and from evidence-based medicine that when you have common approaches to common conditions and diseases and you reduce variability in practices, that you have higher and better outcomes. And that's not to say we're talking about cookbook medicine, but the general approach to congestive heart failure or the general approach to pediatric illnesses, infectious diseases, the more that we can bring together the resources from across the system of our talented physicians and other providers to raise the care processes, the better the outcomes will be for patients. So it's the twofold mission of patient care experience and clinical processes to improve outcomes.
Okay. Well, let's talk a little bit about, you talked a lot about the goals. What about the long-term goal when we're looking into the future and everything's coming together nicely? It kind of seems like the beginning of a journey. So what's the long-term? I mean, you probably think you've been on this path for a while.
It is. It's not necessarily the Emerald City.
I love Wizard of Oz.
Okay,
Did you
I
know
understand.
that?
Yeah.
Okay.
It won't be a yellow brick road. I can assure you that. But our hope is that we build towards being considered one of the most innovative rural academic health systems in the country, where people look to us as a model of how you can deliver high-quality community-based care that's linked to an academic health system that looks to the continuum of care from primary care all the way through post-acute care, and that that our national visibility will be a point of pride for the citizens of West Virginia, but also that pride is based upon the fact that we're doing high-quality outcomes with all of our providers, our community physicians, our academic physicians, the entire interprofessional health team.
Mm-hmm. You know, and just from my personal experience, the collaborative efforts that have come from this are really quite exceptional, especially for us in the cancer program. And I know we're going to talk about that a little bit more, but I don't think the impact is really realized. Of course, you know what it is, and those of us who've had the chance to do the collaborative effort, and it really is going to be a whole different experience, I think, for the patients.
And I think that's cancer is a great example of the collaboration that can cut across the entire system. You know, one of the most scariest diagnoses that a person can have is that you have cancer, and there's immediate, almost catastrophic thinking about what that means for you as an individual. But if you can receive treatment close to home within your social support network, but also be assured that you're getting the latest and most cutting-edge clinical interventions for that cancer, it's a win-win situation, because you're getting the technology and the clinical services that you could get anywhere in the country, but you're close to home. You're close to your social support network, and embedded in that is I think the opportunity for hope. So you move from fear to hope. And I think that's a tremendous key to successful treatment for patients with cancer. So that's what we try to bring with our affiliation agreements.
I completely agree. I couldn't agree more. Well, we have a lot more to talk about, but we're running out of time for this particular segment. So we're going to go ahead and take a quick break, but we will return to discuss WVU Medicine Camden Clark Medical Center with Dave McClure when we return. Now remember, the lines are open to take your calls. Stay with us.